Moderate coffee consumption is not an issue, especially after a while your thyroid is coming better, you can certainly consume coffee. My name is Dr. Ben Ng and I work in Mount Elizabeth Novena. My clinic is called Arden Endocrinology Specialist Clinic. Thyroid hormones, in simple terms, is an energy hormone. When we exercise, when we're active, thyroid levels go up. When we rest, it goes down. And it's important to understand they fluctuate according to condition. When you do a thyroid function test, you are really measuring your thyroid at that time. If you're unwell, if you're stressed, if you have illness, you may have an abnormal thyroid function. That does not mean your thyroid is diseased. It's important again to realize that if you have thyroid disease and underactive thyroid means your metabolism is lower, in other words, you're tired, you may be fatigued, you get a bit of swelling in ladies, you have hair loss and abnormal periods. If you're an overactive thyroid, your metabolism is high. Therefore, you have fast heart rate, you have tremors, you have increased sweating, and basically you feel generally unwell. Weight changes can potentially happen in thyroid disease. Commonly, if your thyroid is underactive, you tend to gain weight. If you have an overactive thyroid, you tend to lose weight, but that is not always the most accurate, and I've seen the opposite happen in both cases. Any kind of thyroid disease is, as we mentioned, is a metabolic problem. So, and at the end of the day, what it means is that our body cannot use energy properly. An underactive thyroid, we tend to use too little energy, while in an overactive thyroid, there's too much energy burnt up. So can this lead to diabetes? Certainly it can, because at the end of the day, if you look at it, diabetes is a problem with sugar metabolism. So if it's not surprising, if you have a problem with energy metabolism, sugar is a form of energy as well. Thyroid disease is a problem with energy. So if you have an overactive thyroid, you tend to have higher metabolism, and if you have an underactive thyroid, you tend to have a lower metabolism. Diabetes is also a metabolic problem. It's an inability to use sugar. Therefore, it's very important. Is there an association between the conditions? Certainly there is. And it's important, therefore, to control your thyroid condition. And in many cases, if you control your thyroid disease, your blood sugars automatically get better. When you have an underactive thyroid, the simple treatment is to replace it. Your thyroid is not working, we give you thyroxine. And it's important to know the correct amount to give, and that again can vary from circumstance to circumstance. If you're doing more activity, if you're overweight, or you've lost some weight, that dose changes. If you're overactive, ultimately there are a lot more treatment options because their condition can be more complicated. The initial treatment option, and if you're an overactive thyroid, is to induce remission. In other words, we initially start with oral therapy and we try our best to get the patients to have a normal thyroid and stop treatment. This doesn't work all the time, and in certain circumstances, what we need to do is consider surgical options if we can't control. In other words, we have to operate and remove the thyroid gland, and in certain circumstances, we have to radiate the thyroid gland by giving radiation to treat the underlying condition. There are a lot of diet recommendations you can see online for thyroid disease. I think the basic principle you have to understand is a few things. There are many people who talk about iodine and thyroid disease. Now, the principle is that iodine is used by the thyroid gland to produce thyroxine. The problem you have is that if you have an overactive thyroid and you overconsume iodine, then your body will tend to produce more thyroid hormone, which is clearly a problem. If you are on medication, this will hopefully help, so you can have some iodine products such as seafood and all that, but do be careful not to consume too much. If you're underactive in thyroid, basically consumption of iodine doesn't help very much. The other principle of thyroid disease and diet is many people believe that their diet affects their antibodies and their immune system, and that to an extent probably is true. Most of the thyroid conditions that we have are what we call autoimmune diseases. In other words, the body attacks the thyroid gland. Many people have tried different diets to say that, oh, this diet may reduce my antibodies and therefore it may cause less of an inflammation on my thyroid. So far, the data is very limited. There are many people who are concerned when they have an overactive thyroid and they're concerned about the amount of coffee they drink. I think coffee, what it does essentially causes palpitations. It makes the heart go a bit faster. And if you have an overactive thyroid, one of the side effects of a higher metabolism caused by thyroid is a fast heart rate. So yes, if you start to drink more coffee and you have thyroid disease, you may notice that your heart go a bit faster. Is that a problem? Well, not really. I think it's important to understand that first control your thyroid condition, but I think moderate coffee consumption is not an issue, especially after a while your thyroid is coming better, you can certainly consume coffee.